Hi, this is Glenna Cernuska from STAT 507. I'm here to present my surveillance presentation. My topic is respiratory syncytial virus, also known as RSV. Background information on RSV is that it causes lower respiratory infection among infants and young children worldwide. RSV is a common respiratory virus that usually causes mild cold-like symptoms like a runny nose, cough, sneezing, fever, wheezing, and decrease in appetite. However, RSV can be very serious, especially for infants and older adults. Most people like you and I recover in 1 or 2 weeks. That's normally. RSV is the most common cause of bronchiolitis, which is inflammation of the small airways in the lung, and pneumonia, which is infection in the lungs, in children less than 1 year old in the United States. It is also a significant cause of respiratory illness in older adults. Annually, in the United States, RSV has been associated with 57,527 hospitalizations. And I'm a nurse right now on the pediatric unit, and we have so many kids who have tested positive for RSV and are being treated. 2.1 million outpatient visits among children aged less than 5 years. RSV circulates during fall, winter, and spring seasons. It varies on temperate climate zones. And knowing the start of the season provides a guide for the healthcare providers for diagnostic testing and timing of immunoprophylaxis. Risk factors for RSV: premature infants, young children with congenital heart or chronic lung disease, young children with compromised or weakened immune system due to a medical condition or medical treatment, adults with compromised immune system, and older adults, especially those with underlying heart or lung disease. My surveillance questions. Number 1, when is RSV most commonly seen? Knowing the start of the season provides a guide for healthcare providers for diagnostic testing and timing of immunoprophylaxis. So knowing when it is most commonly seen is very important in the treatment and diagnosis. What is the duration of RSV season? Knowing the duration of the RSV season will allow healthcare providers a time frame of when to test and treat for the virus and how long they need to treat the virus. My data source, collection and quality. The CDC collects information on cases and outbreaks of RSV infection in the United States using the National Respiratory and Enteric Virus Surveillance System, also known as the NREVSS. The CDC analyzes data on RSV activity at the national, regional, and state levels collected by the NREVSS. The NREVSS is a voluntary, laboratory-based surveillance collection system established in the 1980s to monitor trends in several viruses, including RSV. NREVSS tracks the number of RSV tests that are done by participating laboratories and the proportion that are positive by specimen type, location, and when they were collected. Serotyping, demographic data, and clinical data are not reported. Data from the NREVSS provides information to public health officials and healthcare providers about the presence of RSV in their communities. Analysis. The NREVSS records U.S. laboratory-based specimen data on RSV. Participating laboratories voluntarily report the aggregated numbers of tests performed and positive results each week. The season onset, offset, peak, and duration are all reported for each region. The data collected provides weekly updates to healthcare providers to enable them to make appropriate clinical decisions and provide the best possible treatment. The results for my first question are participating laboratories report weekly to the CDC the total number of RSV tests performed that week and the number of those tests that were positive. The trend graph to the right displays the weekly national average percent of diagnostic tests positive for RSV among all the diagnostics performed to detect RSV as reported by participating laboratories. Fall, winter, and spring are more common. That's the peak for RSV. And the highest peak, as you can see if you look at the graph on the right, the very top peak is in December and January. And for my second question, for 2016 and 2017, the RSV season onset ranged from mid-September to mid-November. Season peak ranged from late December to mid-February, and season offset ranged from mid-April to mid-May in all 10 U.S. Department of Health and Human Services regions, except for Florida. Florida has an earlier RSV season onset and longer duration than most regions of the country. Seasonal patterns remain consistent with previous years. And the graph on the right shows the duration of RSV season by U.S. Department of Health and Human Service regions from July 2016 to June 2017. And it breaks it up into areas and locations, and it shows the duration of how long it lasts. Limitations. I did not find any limitations for this surveillance study. Conclusions. The NRE-VSS is vital in continuing to survey RSV data and keep healthcare providers informed so they can diagnose and treat patients. Healthcare providers must continue to educate patients and families on prevention of spreading the virus by proper hand washing, covering their nose and mouth when sneezing and coughing. There is no specific treatment for RSV, though researchers are working to develop antivirals. There is a medication called palitivizumab. It is a monoclonal antibody. It's recommended by the American Academy of Pediatrics to be administered to high-risk infants and young children likely to benefit from immunoprophylaxis based on gestational age and certain underlying medical conditions. It is given in monthly intramuscular injections during the RSV season, which generally occurs during fall, winter, and spring in most locations in the United States. And I've had several home care patients that do receive this vaccine. The only negative is that the vaccine costs $3,000 per dose. So that can be very hard for some families to be able to afford the treatment. The next steps would be to study this medication, this antibody, and how it affects with RSV. I would be very interested to know the effects it has had on RSV. And some of the questions I came up with that I would be interested in is, does it affect the duration of the virus? Does it prevent RSV when given prophylactically in high-risk infants? And are there any side effects from the antibody? This concludes my presentation. Thank you very much. Have a great day.